give me your name and date of birth?
Ivy, November 2nd, 1995.
Okay, and that matches in the system. Do you know why you're here?
Yeah, I have a hurt wrist.
Oh, okay. Yeah. How old are you?
24.
Okay. Do you know who the president is?
Yes, unfortunately.
Okay, I'm going to go ahead and collect your vital signs. I'm going to get your heart rate, your blood pressure, your temperature, your oxygen, your respiratory rate, and your pain level. Are you having any pain?
A little bit.
Okay, so I'm going to do a head-to-toe assessment. So I'm going to look at everything, and we'll start at the top and work our way down. I'm going to look at your eyes and your facial features and make sure they're symmetrical. And your ears are the same level, your eyes are at the same level. I'm going to look to see if one side of your face is drooping or if if they're symmetrical on both sides as far as that goes, which they look fine. I'm going to also kind of observe while I'm talking to the patient and see if there's any spontaneous movements of the face, and if there are, I'd note that, and also look for lesions. So I'm going to test cranial nerve 7, which is a facial nerve. So can you close your eyes tight? Great. Can you smile? Good. Frown and puff out your cheeks. Okay, that's intact. Okay, and then like while I'm talking and depending on where she came from and stuff, I would assess the hair for lice or any scalp lesions or balding, anything like that. And then I'm going to look at the trigeminal nerve, which is for chewing. So I'm going to put my hands back here. Can you open and close your mouth? And I'm going to feel for any crepitus or any popping or resistance. And then I'm just going to touch your sinuses to see if you have any tenderness. So just let me know. If I apply pressure here, do you have any tenderness?
No.
How about here?
No.
Okay, good. When I look at the eyes, I'm looking to see if there's any swelling. I'm looking to see if the sclera, the white of the eyes is clear and not yellow. I'm also looking to see if the conjunctiva is pink and not red and swollen, that the pupils are equal and and one pupil is not larger than the other, and that they're not cloudy or clear, they're clear. And so all of that looks good. All right, so now we're going to test another cranial nerve, which is the ocular motor, the trochlear, and the abducens. So with this, look at this light and just follow it, or this pen actually. Okay, good. Her eyes crossed, which they're supposed to. Okay, now watch move the side to side. Okay, good. And then her eyes moved, and then up and down. Okay, good. So I'm looking for any stigmatisms, or I'm looking for any I guess static movement with the eye. And I'm also watching her eyes dilate. Okay. And now I'm going to watch them constrict. So I'm just going to look in one eye. Good. And this one. Ooh, that's fun. Okay, so I'll just go ahead and document Perla because they're all normal findings. I'm going to look at the ears and I'm going to assess for any earwax or drainage, which it doesn't look like you have any. Do you have any trouble hearing me when I whisper?
No.
Okay. And then, are you having any ear pain?
No.
Okay. So then I'm going to look at, or I tested the or what is that called? Vestibular ocular nerve. That's what it is. When I lowered my voice and she could hear, so it looks like her hearing's good. And then I'm going to look at the nose, look for symmetry with the nose, which that looks good. Look for, you have any drainage in your nose? Can you close one nose and breathe in? And the other one? Okay, I'm going to look to see if there's any
Anything in there?
No blockages, no redness, no polyps. Okay, you're good. So then, and if I was concerned in any way, I could test the olfactory nerve, but I'm not going to. The mouth. So, say ah. Okay, good. Everything looks good in there. What I'm looking for the mucous membranes to be pink and shiny, the teeth to be white and free of cavities, and no broken teeth or loose teeth that they could potentially choke on. Also the tongue, let's see. Looks good. I'm looking for moist and pink and not cracked, no lesions, no scrapes. Can you lift up your tongue? Okay. And the tonsils I saw also, and the uvula is midline, and when she says ah, it raises up, so that tells me that everything's good as far as the hypoglossal. So also, can you stick out your tongue? Can you move your tongue side to side when you stick it out? There you go. All right, that looks good. Okay. So can you swallow with these? Yeah? Do you have any hoarseness when talking?
No.
Okay. And it doesn't sound like it to me either, but that's the vagus nerve, just in case. All right, so I'm going to look at the neck. I'm looking for the trachea to be midline, which it is. I'm looking for any lumps or goiters, so I'm going to go ahead and palpate, which I don't feel any. So can you turn your head to the side and up? Kind of like this. Watch me. Yep. So I'm looking at her jugular vein. It's not distended, and go to the other side. So that shows me that she doesn't have any cardiac dysfunction that's going on as far as that goes. Let's see. Okay, so then I'm going to listen to her carotid artery and see if there's any bruits. I'm listening for swishing. No? No. Okay. All right, so let's see. I'm going to test cranial nerves, the accessory nerves. So can you shrug your shoulders? Can you move your head from side to side, which you just did actually, and up and down? Yeah, good. All right. So as far as her extremities go, I'm looking if she has an IV. I'm going to assess the IV. I'm going to assess for drainage and redness, and make sure there's no swelling around the IV or any swelling in general with her upper extremities. I'm going to look at for deformities, for osteoarthritis, for any nodules that are on her fingers. Let's see your skin real quick. So I'm going to do skin turgor, and it has a really good bounce back, so she's hydrated. Can you do this? There's no crepitus there. Do you have any pain? What about this with your...
A little bit.
Just on that one?
Yeah.
Can you do it again? I do feel a little bit of crepitus in that one. Okay. So can you put your arms out straight? And then I want you to push up. Good. And down. Okay. And then also I want you to squeeze my fingers. Okay. That's all equal, and I'd give it a 5 in both areas. Okay, and close your eyes. Extend both arms for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, good. So I'm looking to see if your arms drift up, but they didn't. So that's all good. Okay, chest. So I'm looking to see if she has accessory muscles that she's using when she's breathing, if she's a barrel chest, which it doesn't look like, and looking at her scapula to look if it rises evenly when she breathes, which it does. I'm looking for the quality and pattern of her respirations, and it's, relaxed and even. And I'm looking to see if the patient has a pacemaker or any wounds, and I'm not going to make you take off your shirt, but normally I would. Any masses or bulges or muscle tone. So I'm going to go ahead and listen to the heart. And I'm going to listen to the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. Okay, those all sound good. Then I'm going to go ahead and listen to your lungs as well, so just go ahead and breathe in and out. And listen on the back. Okay, her lungs sound clear. Alright, so also when it comes to respiration, I'm looking at her face. I'm looking to see if there's nasal flaring, pursed lips, the color of her face, the color of her lips. Alright, so I'm not going to have you lay down flat, but normally I would. And while I was doing that, I'm gonna look at your stomach. So when was the last time you had a bowel movement?
Today.
Okay. Would you describe it as soft or hard or?
Normal.
Yeah, what does that mean?
Not too soft, not too hard.
Oh, okay, that's good. Do you have any problems with urinating?
No.
Okay. When was your last menstrual period?
Today.
Oh, today was your last one? I'm going to listen to your abdomen.
I mean, I guess it's happening.
I'm just listening for sounds that I hear of movement. And once I hear it, I move on to the next spot. And I'm just going to press. And let me know if you have experienced any tenderness. Okay, it's soft and there's no lumps. And then also her stomach is flat. There's no rounded or protruberance. There's let's see. And I describe her vowel sounds as normal. Alright, so I'm looking at your legs. I'm looking at the color of your legs. Do you mind taking off your shoes? I want to look at your toes.
My socks too.
So her legs are warm. Yeah, your socks too. Let me see your hand real quick. I need to do tap refill on your finger. Yeah, that's less than 3 seconds. And your toe? Oh, yep, that's less than 3 seconds. Okay. So there's no sores on the feet. There's no breakdown of anything, any skin breakdown. Especially with diabetics, we're looking for that because often they can't feel a skin breakdown. And then, let's see, I'm going to go ahead and feel your pulses. So you can put your foot down. Okay, that's even. That's even. Your wrist ones. Well, that's even. If it's even down there, it's even in your wrist, you know? Oh, I also want to have you, sorry, put your foot up. Okay, push against my hand, point your toe. There you go. And then flex your toe, flex your foot. There you go. And the other one. Point, whoop. Flex, good. Whoop. So relax, and see, I just want to see what happens. Well, your toes are supposed to curl in.
My feet aren't ticklish.
Well, it's a reflex. But her feet aren't ticklish. So. Okay. And then I would turn her over and I'd look at her backside and just make sure there's no lesions or anything like that. Bada bing, bada boom, we're done.